Hello, 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 amigas, and welcome to Amiga Handle Your Shit podcast. I have this beautiful soul in front of me. Her name is Erica Montes, Dr. Erica Montes. She is the Modern Mujer, and we're going to talk a lot about that because let me tell you something. She is an OBGYN specialist, certified, and I really needed her to come and show us and talk to us about our reproductive organs, amigas, because guess what? All of us have it, right? All the women have it. And so I felt like it was imperative to have her as a guest. And if you don't know, she has some amazing TikTok episodes and reels. And it's like incredible because she educates us, but makes it in a fun and light way. So you need to definitely follow her because she's freaking badass. So I'm excited. I'm so excited. Welcome, welcome, Dr. Montes.
Oh, thanks, Jackie. That was awesome. Thank you so much.
Oh, well, absolutely, amiga. So for those of us out there in this world that don't know you, can you let us know like a little bit about you before you became a doctor?
Yeah, sure. So I'm a Texan, a Tejana, a proud Texan. My family is, I'm actually third generation, but we did grow up speaking some Spanish. And I grew up in Dallas and El Paso, for all my ladies out there who are familiar with those cities.
Yeah.
And basically, I was the oldest of three girls. My parents did get a divorce when I was in middle school, but we kind of pulled through. My mom was a single mom and she did, everything that she needed to do to keep us going. And I, just kind of focused on education. I, really didn't have anyone who was pushing me because I didn't know initially what I wanted to go into, but eventually I found my way into the medical field and I blossomed there and it's been amazing.
I can see that. So you're a Texan. So you went to schools in Texas, right?
That's right. Yeah, I did all my schooling in Texas. That's correct.
Okay. And including your medical school.
Right. I went to med school in San Antonio.
Ándale, mira.
In San Antonio.
San Antonio, Texas, amigas out there. So tell us, okay, so you're no longer in Texas, are you?
That's right. So my husband, I actually met him in San Antonio, and when he was an intern in there, and he's from California, I'm from Texas. So we were kind of like, where are we going to live? What are we going to do? And so we split the difference and we ended up in Arizona, and we've been here now for 9 years.
Wow. And you have a private practice?
That's right. That's correct. Okay. So I'm in my private practice is called Cornerstone Women's Care, and we are in Scottsdale, Arizona. And I've been now with them for about almost going on 6 years, and everything's going great there.
Amazing. Now, amiga, tell us. Okay, so I was reading that you have this blog, the Modern Mujer. So how did that come about? Because I mean, I can totally see how busy you are as a doctor, and then to have a blog, like what? Hello.
Yeah, I know. That's what everyone says. They're like, how the heck do you do it all? So I guess I just kind of try. Well, first I kind of make every minute count because I usually, like, if I have some time, at lunch or whenever, like if my boys are asleep or resting, I kind of try to get things done during that time. But the Modern Mujer kind of came about when I was in my postpartum time after having my third son. And I was just up one night, you know how you're tired, you're like, just kind of your mind wanders at 2 a.m. And I was like, well, what can I do I thought I know so much at this point as, a full-time OBGYN. I have 3 babies. I feel like there's so much that I can share and kind of put myself out there also to inspire other Latinas to go for higher education and in general, and of course the medical field. And so with that, the Modern Mujer was born, and I just kind of thought of a fun name to kind of put a little spin on it, like English and Spanish. And I started it, I guess, October of 2019.
Well, I was reading through it and I'm like, oh my God, this woman is fabulous. I need to have her here on my podcast. All right, my lady. Okay. So here you are, you're an OBGYN and badass at that. And so, of course, as amigas, women out there,
Mhm.
we want to learn more about our bodies. And so I'm curious, like, what have you seen that is like of paramount importance that a woman should do to
Right.
protect their bodies because I know there's so many illnesses out there that only pertain to a woman's body. So what do you see?
So, that's a great question, because I know going to the gynecologist is not the funnest experience in the world. Some patients are like, it's worse than going to the dentist. I'm like, okay, well, hopefully it's not that bad, but it's embarrassing. It's just one of those, it's not something that's just super easy to kind of overcome if you have a fear or if you've had a bad experience in the past. So I totally understand that. I always tell my patients, I really, really want to see you every year as an OBGYN. In a way, we're kind of like your primary care doctor because a lot of women don't see just a PCP or a primary care doctor. They kind of use their OBGYN as like their main doctor. So it's important, for you to just take one day a year out of your busy schedule, and just make an appointment so we can do your full exam. We can keep your screening and preventative tests up to date. I do labs for my patients, just general labs like checking your thyroid levels, your liver and kidney functions, your vitamin D. All that's important to keep you running, to keep you healthy and to keep you where you're supposed to be in life. So, if you're not healthy, no one's healthy in your family. So you just really have to keep that in mind.
So let's say for a woman that forgets to do the annual and it just continues on, like for instance, like a 5 year doesn't come. What have you found? Like, is this like super detrimental to a woman not to do the annual?
Yeah, I mean, at this point, we do have different pap screening guidelines because every time a woman thinks that it's an annual, they think, oh, that's my pap smear every year. But in reality, just a quick little tip for women to know. So a well woman exam or annual exam is just an exam of their breast and your pelvis. Doesn't necessarily include a pap smear, but it depends on your history. But, if we have these preventative measures, such as the mammogram, which is an annual recommendation, is when you turn 40, and then also the pap smear, which is every 3 years, depending on your age, but for sure every 3 years after age 30, then it's just one of those things where if you can prevent it, you want to go ahead and do it, because I have seen cases of cervical cancer in women who haven't had their pap smears done in even as early as between 6 and 10 years. And then I have seen early breast cancers in women who are like, oh, I'll just put it off to one more year. And then it ends up being, early cancer. And so we just want to, if we can prevent it, why not do it?
Oh, exactly. Oh my God. I start to think about certain times that I'm like, when COVID happened back in 2020, I was supposed to go get my annual and I didn't go. And then also the breast, because I'm 47 years old. So obviously these things are super damn important. Right?
Yes.
And then I remember the technician who was like, wait a minute, when was the last time you were here? And she was mad. She was super mad at me. But luckily everything came out well. But it's super important, right? I mean, because cancer can come up like that.
Right, exactly. And that's what I tell patients, cancer doesn't wait for anyone. It just does what it wants to do. And even if you don't have a family history, environmental factors play a role. So everyone needs to be screened when at the appropriate time. And it does depend on your age and your history, but your doctor knows what the right screening time frame is for you. So that's why you should go every year. So that way it doesn't fall through the cracks.
Absolutely. And so now that we're talking about cancers and whatnot, what do you find to be the most threatening area of concern for a woman?
That's a great question. I mean, as far as cancers go, I would definitely say breast cancer, because 1 in 10 women do suffer from breast cancer. Sometimes we tend to think of it as back in the day, I think a lot of us thought of it as like a white woman's disease, and that, Latinas really wouldn't be affected. But, what we do see is there is a great disparity between Latinas, or women of color, Latinas and Black women, because what we do see is that their breast cancer, when it is diagnosed, is actually at a later stage, and they do have a higher mortality rate because of that. And, part of it, I think, is cultural. Like, si me siento bien, estoy bien. If I feel fine, everything's okay. I don't have to go get checked. Or, it's one of those things where, it's, you like, again, embarrassment, that kind of thing. Your moms maybe didn't grow up talking to you about going to get evaluated, or them going every year for their annual checks. So I think breast cancer is definitely prevalent, and it is prevalent in our community and the Latina community. And we just have to be a little bit better about talking to our friends about it, and just kind of giving each other tips and saying, hey, did you go get your mammogram this year? I got mine, go get yours. And, just kind of bring more awareness to it.
Absolutely. I think education is very important, because I mean, if we made it like a party kind of thing, hey, let's all meet up and do our exams together. I mean, I feel like that should be like a TikTok.
Yeah, there you go. We're gonna have to do one of that.
Like a party. Let's all get our mammograms. I mean, seriously, like, and I love your TikToks, because some of the stuff that you do, I'm like, oh, that makes sense. Especially the one that I saw that has to do with like cysts and fibroids. And I thought, oh my God, that is very prevalent. I know that. I had that before I got pregnant. And my doctor, my OBGYN, was saying like, wow, and you got pregnant very easily. And I'm like, oh, I did? I had no idea, because the positioning, I guess, of something. But how common is that? Because I feel like it's one of those things that happens a lot when we get our periods, and we don't pay attention. Because I know that my periods were so strong, and like, oh my God, they were so debilitating. But I had no idea for so long that I had these things in my body.
I agree. So as I mentioned, like, as far as cancers go, breast cancer is the one that we all need to be looking out for. And as far as just general benign conditions, I would say fibroids could be the one that is very, very common. Actually, up to 80% of women have fibroids. It is more prevalent in African American women, but we definitely see it a lot in Latinas, in Asian women, and of course, Caucasian women or white women. So it's kind of across the board, and there's a lot of factors that play a role into it. A lot of it is genetics. Some patients say, well, all the women in my family had hysterectomies, and come to find out, it probably was due to fibroids. But fibroids are basically a benign tumor of the uterus. They can be different sizes. If you look at my reel, I kind of break it down into like an easy to understand way, like with fruit, like anywhere from a blueberry to even a watermelon. And they just they grow in the muscle layer of the uterus. But they can kind of be on the outside, on the inner wall, on the inside of the cavity, and depending on how big and where they're located, that kind of determines what symptoms patients have.
Oh my God, yes. Because when you did that TikTok, I said, oh, now I get it. my OBGYN is a male.
Okay.
So he's not, I mean, I guess he thinks I'm a doctor too, because he like explains it like, and I'm like, what the heck? What are you telling me here?
Yeah, no, I just do when I talk to my patients, I talk to them like if I'm talking to my sister or my cousin, I'm like, okay, lady, let me tell you what this is and what we're going to do, because you guys don't understand, that lingo that we use with each other. So if I'm talking to a colleague versus a patient who just is hearing a new diagnosis for the first time, I'm going to break it down into an easy to understand way. So that way, when you leave the appointment, you're you actually know what you have. That's another thing. I really want women to, if they've had any procedures done, any kind of diagnoses that their physicians have given them, especially female health issues, write it down, know exactly what they did. I've had patients come to me and say, I had a hysterectomy. And then I examine them and I say, no, lady, you have your uterus still. And they're like, what?
I mean, I don't mean to make light, but I bet
It's
you anything.
true.
But it's, yeah.
You guys, all of us, even if we don't know like what the difference between a uterus or a cervix or an ovary is, you know, if you have a problem, educate yourself. There's so much information out there nowadays that even if you don't really know what it is, you kind of should have an overall generalization, or ask your doctor for your op report, you know, your operative report, and read it. Know what we did, know what you have and what you don't have. It's very important.
I think that is super important, amigas. Ask for the operative report. Is that what you said?
Yes.
Okay. So that's kind of like a discharge. I don't know. Please educate me. What does that mean? Because I'm a lawyer. I can tell you what a certain document is all
there
about.
You go. You're like, I don't know what that's a whole nother document. So basically an op note is the report that, for example, whenever I do a surgery on a patient, I have to dictate a note, and I say you know, what their pre-op diagnosis was, what their post-op diagnosis was, what I found, what I did, how I did it. And so if patients have that piece of documentation, that gives me as their new doctor or their continuing doctor a lot of information. And then it also, even if you don't understand exactly what they did, you can take that to your new doctor or your doctor that's going to take over your care, and then we can explain it to you because we actually see it in front of us and we know what they did.
Oh, well, thank you for that, because I think a lot of us out there are like, ¿qué es eso?
I'm like, señora, ¿tienes tus ovarios o no? And she's like, yo no sé. So I'm like, do you have your ovaries or not? And she's like, I don't know. But I mean, we need to know these things because it's happened multiple times where a patient, they'll say, I had this done, and I go to the operating room with them and I look inside and I'm like, actually, it was X, Y, and Z, you know, and it's not good for patient care.
No, it's not. And I think that I find that it's super important to have someone that speaks your language the way you speak it versus this technical thing, because I mean, really, the whole point of going to a doctor is to feel good, not only good, right? But then also, you know, get educated about in terms of what's going on in your body, you know, and if you give them all these technical terms, how the heck are they going to know?
That's right.
Pobrecita, I feel, oh my God.
Well, imagine like a lady who doesn't speak English, you know, and I mean, I know someone's probably, hopefully translating for them, but you know, they're missing so much information on multiple levels, especially if you don't break it down for them in a way that's easy to understand. So that right there, I know that is something that every healthcare provider needs to work on. And even just in general, like in your arena, you know, like if you told me a document, I'd be like, I don't know what you're talking about. So I would have to say, what does that mean? But I mean, it's just a matter of educating yourself and working on being better communicators.
Yeah, definitely. And you know, one of the things that I want to go back on this point that you made, you're a surgeon as well, right? And so, you know, can you tell us what is your most common surgery and why?
Yeah, that's a great question. So I would say, I guess I would say a hysterectomy. So there's different, so a hysterectomy is when we remove the womb or the uterus. And a lot of women kind of, when I say that word, I don't know if it's just some kind of generalized thinking where as soon as I say that word, they say, but I want to keep my ovaries. And we actually can remove the womb or the uterus where a baby is carried. And that's where the blood comes out of you every month for your period. And keep your ovaries. It's very simple. It's very easy. It's just the technique that we use when we do the surgery. So I would say, yeah, I mean, like, for example, this month, we consider that a major surgery. I have 5 So that so, if you have about 5 to 10 a month, that's pretty typical. That's pretty common. And it's one of those things where just a lot of women at some point, I try to start with conservative options because to me, that's the best way to go about it. And that way we don't go straight to a major surgery where a patient will say, you know what, I didn't think about this. I didn't give it enough time to think. I didn't give myself enough time to think about this procedure. And I shouldn't have done it in the end. So I think if we do conservative measures first, then that's good for everyone. But yeah, I would say a hysterectomy. I do also a lot of tubal ligations, which are sterilizations to not have any more babies. That's a pretty fast procedure. It's done laparoscopically with 2 small incisions, where we burn and cut the tubes. And I would say probably those 2 are the main.
They're like, I don't want to have any more kids. Let's stop the production of children.
Exactly. They're like, nope, we got to be done here. I mean, I always tell patients, tell your partner to get a vasectomy, but
I think it's in the Latino community, it's one of those, like, the men are, I mean, I'm glad that I can cuss on this thing, but
exactly.
They're like, what? No, ni madre, ni madre.
Yep. They're like, don't touch me. No me tocan ahí abajo. I'm like, no, I tell the patients, I'm like, it's way easier, less risky for your partner. And I even have, before COVID, I would have the husbands come in so I could talk to them about it. And they're like, well, what do you do it? And I'm like, no, I don't do that surgery. I'm not a male doctor, but I know who can do it for you. Right. So I think it's just a lot of it is education and like cultural and machismoism and all that kind of stuff. But I think we just have to, if they don't do it, I just feel like, I'm fine with doing the tubal on them because it's, at least they're taking their own health into their own hands. They're not having to rely on someone else. And so I say, let's just do it. It's fine. And everything turns out great for them. They're happy in the end.
Yeah, totally. I completely agree. Now, wanted to, talk about just in terms of like a woman, in the younger years and then versus the later years, like, what do you suggest, or maybe a tip or 2 on what you must do in your early years and then what you must do in your later years as a woman?
Yeah, that's a great question. So one tip for the younger girls is you must use protection. It's very easy.
Yes.
Please, because I mean, look, HPV or the human papillomavirus is very prevalent. About 90% of the population will have it at some point in their lives. And HPV is more a virus that is transmitted through skin to skin contact, not necessarily through penetration, but the percentage that you can decrease the transmission is very high with condom use. So, and besides that, there's gonorrhea, chlamydia. Patients who have that, they think it's an easy fix because you take antibiotics, but that could cause you to be infertile for the rest of your life. And you don't want that to happen when you're young and having fun. So please use protection. That's one of the main tips for young girls.
Amigas, you can still have sex, just use the protection.
Exactly. Because when you guys are coming in with, your tubes being blocked because you were having too much fun and you didn't get treated fast enough, then that's when you regret it, and then HPV too, you're going to have to go through all those procedures where I'll have to do the colposcopy on you, which is that procedure where we look at the cells a little closer under the microscope. And then there's excision procedures that we have to do. And it's just a chronic thing that kind of gets annoying and patients hate it. But I mean, that's the reality of it. I would say, pay attention to your body when you're younger. If you have a big change in, in your cycles, or you start having changes in your in your hair or your face, more facial hair, or just little different things that, maybe you don't think are related to the female organs or to your female health, but they do. Or even just recurrent infections, like recurrent yeast infections. Maybe that means you have diabetes. So there's certain little things that are different in your body. And even if you think, oh, well, it's probably fine, it's normal, it's going to be okay, it's those recurrent and new things that we kind of are. It's not something so, I guess the word would be, it's not something so immediate where we're like, oh my God, I got to go get checked right now. I'm not in a ton of pain, so I just kind of leave it to the side. But those things that change over time, a gradual change or a kind of recurrence, those are things you need to really get checked out.
Oh my God. And for the older ladies, I'm like, oh my God, I'm fucked up. I'm just kidding.
She's like, I didn't do all that. Yeah, I mean, I think, I don't know. I just kind of came up with those two. I think there's probably other things I could think of for the younger ladies, but definitely those two. For the older ladies, if you start having menopausal symptoms, when you do kind of start going through menopause, I think maybe in the Latina community, like we may just be like, oh, es normal, son bochornos, like it's fine, but come get evaluated and come get help. You don't need to live the rest of your life, with, just hot flashes and a horrible inability to get good sleep and all these changes that happen in your body during that menopausal time. Just come get evaluated and get help. The help is there, the treatments are there. You just have to come and ask for it.
Yeah. And that could require taking some hormones replacement, right?
Mm-hmm, yep. And there's also more natural options that I offer my patients, and those help too. So it's just one of those things where, you don't have to be miserable during that time. You just need to go and get help. And then also one other thing for the older ladies is, a lot of women are kind of embarrassed or shy about incontinence or urinary incontinence, where they lose, pierdan orin, they lose their urine. It's common, but that's not normal, because there actually are ways that we can help you with that. Sometimes medication, sometimes physical therapy, sometimes it does require surgery, but you don't have to live like that either. So you just have to go get evaluated, talk to your doctor about that.
Wow, this is all fascinating. I'm so happy. Amigas, if you're young, you know what you got to do. Wear those condoms. Get your man to wear those condoms.
Yep.
And amigas, older ones like me, get evaluated, girlfriends. If you need to get on hormones, you need to get on hormones. We don't need to suffer. We don't need to suffer those hot flashes. Believe me, I know exactly. Oh my God, I love this discussion, doctor. So as we're getting towards the end of our conversation, I always ask my guests if you could provide 1 or 2 tips on how an amiga can handle her shit.
I love that. I love the name of that podcast. I'm actually being pretty good, because I'm not really cussing like I usually do. Jackie's beating me on the cussing side, but all my friends from back in the day, they know that I do cuss up a storm when we're having fun. But well, I guess one thing I would say is, in anything in life, I would say one motto I use is ask for help. The thing is as professional women, we try to do it all, we try to be it all, and I mean, it's just not possible. We need to keep our mental health, we need to keep tabs on our mental health, and make sure that we're surrounding ourselves with positive and supportive people. And so I think that that's a way that I kind of get it, that I'm able to do a lot, because I'm able to always ask for help. And even if you think like it's gonna make me look like I'm weak or I can't do it all, who cares? Doesn't matter. I mean, that's why people are here to help us, and to help us handle our shit so we can get things done and do what we want to do in our lives. So
definitely. Yeah. And I think that's it. There's like a stigma of asking for help, that
Yeah,
we're weak, that,
exactly.
oh, that if it's like you're trading for time, like
Mhm.
it's almost like, oh, well, you wanted to have a big family, so now you're asking me for help.
Yeah.
It's kind of like, what the fuck?
I know exactly. It's like, okay, well, at least, I think it's just important for us to do that, because if we don't, then that's when everything kind of goes downhill for any woman in any career. Even if you're a stay-at-home mom, I mean, you still need help, especially stay-at-home moms.
Absolutely, absolutely. I couldn't agree more with you. I remember when I had my daughter, I was like, I can't. I mean, I didn't. We didn't get a discussion here about postpartum depression, but it's very, very
Mm.
rapid, right? And I remember thinking, like, I don't. I mean, I love my daughter, and I just had her, and there's all this, like, the hormones were getting the best of me, and I'm like, I cannot be alone with this child.
Mhm.
I need help.
Right, right. Good. That's very good. That's good. You knew and you asked for it.
Yeah.
Because that's what happens to some of my patients. I mean, you get to the point where you just don't know what to do, and then you do something that you'll regret later. And I've seen that. I've actually seen those sad cases with my patients, and I think a lot of it ends up being that they just, they put on that happy face, but in reality that's not the case. And sometimes we don't, they're fine when we see them, and you can kind of pick up on things, but they play it off too well, or it just, they're all actually okay at that point, and then it kind of gets worse as you go from there. So that's like a big disparity too in the postpartum system that we're trying to improve. I think as physicians, we need to keep better tabs on these patients and kind of have a better relationship with professionals that can help us with postpartum depression too.
Absolutely. I think it's so important. And, we don't want to hear those stories on the news
Exactly.
where
It's
the
so,
mom
so,
went and killed three kids and the kids are like they're 5, 4, 2, what? And it's like, well, knowing how I went through, I'm like,
yeah,
wow,
I
you
know.
know,
It's horrible.
it's horrible. But
And
thank you so much. Oh, yes,
yeah.
please.
Oh, I was just gonna say, and then one last thing on how to handle our shit, which I already
Yes.
said it, but I just was gonna repeat it, is I think we definitely need to basically make time for ourselves and make your health a priority, is basically what I always tell my patients. We, as moms, or as women in the family, we kind of play the central role. We kind of take on so many responsibilities, and we are in charge of everything, from the kids to the house to our healthcare to our family's healthcare. And that's just the way it is. We make the healthcare decisions in our families, and so we have to, in order to be able to take care of others, we need to take care of ourselves. So please, ladies, make it a priority, make your health a priority, physically and mentally. That's really what it's all about.
Ah, I love that. I love that. Ask for help and make your health a priority. Beautiful, Dr. Montes. I really, really love everything that you're saying here. And I wish I can have you here for another session. So perhaps next year we
Yeah.
can stay. Yeah. And then I don't know. I love your TikTok. So continue.
Thank you, honey. Thank you so
Yes.
much.
Thank you so much for being here, because I know you're a busy woman, and go save lives. I love you. Love you. Thank you so much. And we'll talk later. Thank
Okay.
you.
Bye, Miss Jackie. Thank you.
Bye.